Hello everyone, my name is Alex Page, and I had my P4 shadowing at the Health Net of Arizona Incorporated, which is an insurance company that is involved in managed care pharmacy. In particular, I was assigned to shadow Sage Sufpool, a fourth-year pharmacy student, and her preceptor, Dr. Yvonne Johnson, for approximately 4 hours. And throughout my shadowing experience, Sage informed me that managed care pharmacy is a specialization within pharmacy that involves designing and implementing drug benefits for patients that have health insurance. Specifically, if a patient has health insurance, then they're likely to also have a drug benefit, which is essentially health insurance for medications. And government programs such as Medicare and Medicaid fall under this drug benefits umbrella term. And at the Health Net of Arizona, the health care plans tend to apply more towards low-income individuals and families, and the clinical pharmacists there are primarily involved in verifying prior authorizations for patients and determining whether or not more information is required from the doctors' offices before moving forward with the dispensing aspect of pharmacy that you tend to see in the community. And the pharmacists at the Health Net are also involved in conducting quarterly meetings in which they evaluate new FDA-approved drugs and determine what should be added or removed from the Health Net's drug formulary, as well as what criteria needs to be changed. And in addition, Dr. Johnson also told me about a pharmacist at the Health Net that has chosen to take on less of a clinical role with the company and is instead involved in negotiating the cost of prescription drugs with manufacturers in order to make them more cost effective for the patients. So here you see a pharmacist more involved in the sales side of pharmacy. And in general, this is a snapshot of what a typical day in a managed care for a managed care pharmacist looks like at the Health Net, and the work hours are usually from 8 a.m. to 5 p.m. Monday through Friday. Moreover, I was informed by Sage that additional training is required in the form of a 1-year residency in order to work in a managed care pharmacy setting. And throughout Sage's rotation at the Health Net, she has had the opportunity to work on several projects. One of the projects that she shared with me involved her going through patient profiles that were currently taking opioids and assessing the morphine equivalent dosing. And if the chance of overdose was high, then she contacted the patient's respective doctors and informed them that they must prescribe naloxone or an equivalent in addition to the opioids. Otherwise, they would be dropped from the Health Net's plan. And another project that Sage is currently working on is developing guidelines to clarify the difference between controlled and short-acting inhalers for the technicians to reference on the Health Net's drug formulary. And thus far, Sage has had a pretty good experience at the Health Net and likes the fact that she only has to work until 5 p.m. and that the work doesn't follow her home or on the weekends. However, she did say she would have liked to have the opportunity to verify prior authorizations, but understands that only licensed PharmDs are allowed to conduct those checks. When asked if she would like to work there after she graduates, she said she liked how she got exposed to a wide array of different medications that fall outside the realm of the top 300 drugs, but doesn't like the fact that there's limited patient interaction, and since recently having a daughter, doesn't want to uproot her family for a 1-year residency, so she'll likely pursue a career in community pharmacy instead. However, from my perspective, I would be very interested in doing an APPE rotation in managed care pharmacy setting in order to gain insight into the decision-making that goes into determining what drugs should be added to a formulary, as well as how insurance companies typically operate. However, I'm not entirely certain if I would want a career in managed care pharmacy because of the limited patient interaction that exists in this type of work environment. Thank you so much for taking the time to listen to my P4 shadowing experience, and I hope you have a great rest of your day.